Hello, today I'm going to demonstrate the Atlas mattress. So the Atlas mattress is a dynamic mattress replacement system which is intended for use in an acute hospital setting, a long-term care facility or the community setting where medical care is provided. A lower or upper age limit is not defined as it depends on the physical size of the patient in relation to the proportions of the mattress and the bed frame. The mattress is intended for single patient use only. It is the responsibility of the carer to carry out any necessary risk assessments to ensure suitable product compatibility and the safety of the patient. The risk assessment should include, but is not limited to, product combinations such as the bed frame, the mattress, any side rails that you may use. The extent of the tissue damage that the patient may have, if any at all, entrapment, patient falls, compatibility of the patient to the mattress size, patients who have reduced capacity and or agitated, patients with any burns, and of course any people who may have unauthorised access to the controls on the pump unit. We're now going to look at the product use of the mattress. So the Atlas mattress has a maximum user weight of 200 kilograms, which is roughly 31.5 stone. This includes any bedding or accessories that are used on the mattress. The mattress is suitable for up to very high-risk patients and patients with category 4 pressure ulcers. However, you always need to ensure that monitoring and repositioning is carried out as per the individual care plan. A risk assessment must be performed to ensure the suitability of the patient and the contraindications, for example, any unstable spinal injuries. For those patients of a very low weight, typically less than 40 kilograms and a physical size of less than 146 centimetres, clinical judgment is to be used to determine suitability. The support platforms or bed frames used with the mattress can vary greatly depending on the specific healthcare setting. Again, a risk assessment needs to be carried out to ensure the suitable product compatibility is maintained. Please refer to your local policy and guidance on equipment selection and to the full user manual instructions prior to using the mattress in relation to safe use. When setting up the Atlas mattress, firstly you need to place the mattress directly onto the bed frame as you see here. Once placed on the bed platform, ensure that the umbilical cord is at the foot end of the bed and the feet symbol is facing up. Attach all straps to the moving parts of the bed frame, making sure that they are not twisted. Position the pump unit securely onto the footboard of the bed using the integral hooks or a pump unit holder if this is provided with the bed that you are using. Attach the air connector by aligning the male and female ports on the pump unit and pushing into place, ensuring the air hose does not become kinked or become trapped between the moving parts of the bed frame. Attach the pump power lead to the mains power outlet. Press the power button located on the front of the control panel for 3 seconds. The system will begin to inflate. Initial setup should take about 40 minutes. The system ready LED will illuminate green after approximately 40 minutes from initial power setup. Once the system has initialized, the comfort control LEDs will flash together and the pump will beep every 30 seconds to make the care provider aware that the system is ready for use. The control unit will stop beeping once the patient has been added to the mattress. The system will carry out an auto-sensing procedure once the patient is on the mattress. The system will then automatically set the control unit's comfort control to suit the patient. The comfort controls can then be adjusted accordingly. The CPR tag is located at the foot end of the mattress on the left-hand side. Ensure that the CPR tag is fully engaged within the mattress and all the connectors are lined up correctly with no red chevrons on display. Ensure that any bed sheets on the mattress are fitted loosely to reduce the hammocking effect. Tight-fitting sheets may interfere with cell alternation. Ensure no sharp objects are in the vicinity of the mattress. Once the system has been set for the patient, recheck it after approximately 20 to 30 minutes to ensure the patient is comfortable and that the system is functioning correctly. The mattress automatically defaults to alternating mode when it is first switched on. So we're now going to look at the mattress in a little bit more detail. So the mattress cover is multi-stretch, water resistant and vapor permeable. It also has a 360-degree zip, which allows for replacement of the top cover only if required. There are high-frequency welded seams and a zip flap to reduce the possibility of any fluid ingress and also aid infection control. The mattress has a white inner substrate on the underside of the cover, which helps with auditing procedures by making staining easy to identify if the cover has become compromised. The mattress is a cell-on-cell construction. This design ensures that the bottom cell remains inflated if the top cell becomes compromised, keeping the patient supported at all times. The mattress operates a 1 in 2 cell cycle over a 10-minute period, ensuring that 50% of the patient's contact area is supported, whilst the other 50% has pressure relief. There are 3 static head cells providing head support, which eliminates any feelings of nausea, and also 18 alternating cells. We're now going to have a look at the digital control functions in a little bit more detail. So firstly, we have the power button. We also have the system ready light indicator. We have the mode setting for continuous low pressure and alternating pressure. Comfort settings. We have a static mode. There is also a lock and unlock function, a low pressure indicator, service due indicator, a power failure indicator, and an alert mute and pause. So we're now going to take a look at the constant low pressure, the alternating pressure, and the static mode within the mattress. So firstly, patients can be prescribed both alternating or constant low pressure depending on their needs and the clinical judgment of the carer. To change the mode of the therapy, press the desired button and a blue light will illuminate to show which one is in use. The constant low pressure allows the mattress to contour to the patient's body. This reduces the contact pressure by increasing the surface area over which the patient is supported. Constant low pressure mode inflates all cells and then reduces the overall selected pressure by 5 millimeters of mercury. Static mode may be used when a nursing procedure is being carried out or for patient mobilisation. When using the static mode, the system will automatically revert back to alternating mode after 20 minutes. This is a safety mechanism to ensure the patients are not left lying on a constantly hard surface. If the static mode is no longer required prior to the system automatically switching back to the alternating mode, press the button and the mode will transfer back to alternating. The comfort control setting allows for optimum comfort for patients without compromising on performance. In order to use the comfort setting, press the up-down button to select the setting that you require. Once the system has detected the patient weight, the control unit will adjust the pressure accordingly and automatically. The system's pressure can be increased or decreased from soft, which is 15 millimeters of mercury, to firm, which is 55 millimeters of mercury, with a variance either way of 5 millimeters of mercury. Before changing or lowering the pressure, clinical judgment is required in regards to how it may affect the patient. When changing the settings, the blue LED light indicates which of the settings is operational. If a patient's backrest is more than 30 degrees head of bed angle and the patient feels like they require extra support, especially in the sacral area, the comfort setting may be increased. The max inflate mode should be selected when patients are egressing the bed, rolling from side to side for personal care, and moving up the bed. This gives a firm surface for patients to find a purchase, and less assistance is required from the caregiver. When max inflate is selected, after 20 minutes the system automatically reverts back to alternating mode. It is a safety mechanism to ensure patients are not left on an overinflated surface. We're now going to look at the function lock. The control unit will automatically lock out all functionality after 2 minutes of inactivity. When the system is locked, a blue light will illuminate. To unlock the control unit, the lock button needs to be pressed for 3 seconds. To re-engage the lock button, press for 3 seconds or wait for the automatic lock to re-engage. We're now going to take a look at the CPR. Rapid deflation of the mattress may be required for emergency treatment or system deflation. In an emergency or to deflate rapidly, pull the CPR tag away from the mattress. An audible alert will sound and the low pressure light will illuminate. To re-inflate the system, reconnect the CPR and restart the control unit by switching off and then on again. The control unit will carry out its initial setup procedure. Wait for the mattress system to reach optimal pressure prior to returning to normal use. Once re-inflated, ensure the correct settings are reselected for your patient. So we're now going to take a look at the transport mode. In order to activate the transport mode, firstly we're going to remove the tubing from the control box. We're then going to connect the tubing together to form a secure loop. This will equalise the cells. The mattress will then stay inflated for up to 24 hours in normal conditions. Whilst in transport mode, alternating mode will not be operational. So lastly, we're now going to take a look at any troubleshooting, alerts and the mute function. So when a fault is detected within the mattress or the control unit, an audible alert will sound and a yellow light will illuminate to show which of the fault has been identified. In order to mute this alert, press the mute button. The alert will reactivate after 20 minutes. The LED will continue to flash until the issue is resolved. If there is a low pressure alert, the LED will flash yellow and the alert will sound intermittently when the pressure drops below a predetermined tolerance of 5 millimeters of mercury. The alert will sound after 6 minutes of loss of pressure. Check the connector and the CPR for no air loss. Once rectified, turn the pump off, then back on to restart the pump. If there is a power failure alert, the LED will again flash yellow and an alert will sound when the mains power is cut. Check the mains cable is firmly plugged into the wall socket and the control unit and the mains power are switched on. Check the mains cable for any damage. If the high pressure alert sounds, again the LED will flash yellow and the alert will sound intermittently when the pressure exceeds a predetermined tolerance of 5 millimeters of mercury for 5 minutes or more. The service due alert will illuminate after 8,760 operational hours to indicate a service is required. If the fault cannot be rectified, please contact Drive de Vilbiss Healthcare or your service provider. Continence products may be used, however the mattress or the chair cushion performance may be compromised due to the reduced effectiveness of the alternating pressure redistribution.